Good afternoon and welcome to Magic TV News Around Africa that is coming to you live from our 4th floor studios at 22 Bafo Street in Freetown. In our Magic News Around Africa this afternoon, the International Monetary Fund says it approves a new 250 million extended credit facility for Rwanda. The 38-year-month program is aimed at helping the country sustain growth and protect social and developmental spending as it faces tougher economic conditions. Rwanda's economy remains resilient, the IMF said, but warned risk from the war in the Middle East could weigh on the growth, inflation, external balance, and their debt. The country's economy grew by 9.4% in 2025, much more higher than expected, but high international oil and fertilizer prices are fueling inflation and fiscal pressure. Well, according to them, cutting growth to below 6.8% for 2026. The funding urged Kigali to focus on increasing revenue sources, improving public investment management, and enhancing monitoring of capital spending. That is what IMF has already done for the people of Rwanda. Well, from Rwanda, we go to the Southern African country, which is South Africa, which says the manhunt is on the way in South Africa after a group of 10 men armed opened fire, killing 12 people at an informal settlement in Johannesburg late on Tuesday evening. Police said the shooters were dropped at a site in a minibus and moved through the area, opening fire on residents at multiple locations even before fleeing in the same vehicle. As investigators work to establish the motive for the attack, Gauteng Province Top Corp visits this latest scene of a deadly mass shooting in the East Rand region. Gauteng police continue to say that the commissioner, who they quote-unquote said it was too early to say if the incident was related to illegal mining in the particular area, but of course, quote-unquote, he cannot overrule that because I have seen, he said, some of the victims where they were, and some of the victims, they were lying, it looks like the place of a processing center for illegal mining. He continued to say that Jumpers informal settlement is located near several unknown mining sites, illegal mining sites to be specific, and residents are reported as saying they believe the attack was linked to a tough war between groups of illegal miners living in that particular area. Well, at least 9 people were injured in this particular shooting that has left people in shock and has once again raised concern about gun violence in South Africa, to be specific. Well, from South Africa, we go and take another story again, which says the International Monetary Fund has approved a 250 million extended loan for the people of South Africa. Of Rwanda, a little bit, I've gone over the story again. Well, we'll take another story which says Nigeria, a oil farm in Nigeria, is presently facing serious problem as the Dangote refinery has supplied more than 5 countries, and they are also aiming at supplying more people in that particular country. According to the Nigerian broadcasting station, they said the Dangote oil refinery is now processing oil for countries that are facing problem. I hope my country, Sierra Leone, will have that particular opportunity to go through that particular influence. Well, we continue with our stories as the fuel inflation and fiscal pressure cutting down below to that particular figure, as the Dangote refinery has made something like 450 million revenue as of 2025, and as of 2026 they are yet to hit their point, but they are making fiscal expenditure as the Dangote refinery wants to expand. Well, in another story, the Ebola outbreak in the Democratic Republic of Congo and Uganda has surpasses 600 confirmed cases and claimed more than 100 lives, as health authorities warn that insecurity, resources shortage, and travel restrictions are hampering efforts to contain this particular virus. Confirmed Ebola infection in the Democratic Republic of Congo and Uganda have claimed to 608, with 102 deaths recorded as of June 8th of 2025. 2026. And according to the African Center for Disease Control Prevention, CDC, the CDC remained epicenter of the outbreak, reporting 558 confirmed cases after 45 new infections were detected within 24 hours. Uganda reported no new case during the same period. Health officials believe the real number of infections could be higher due to underreporting and challenges in accessing affected communities. Well, they gave some pointers that they say will affect this particular one. The first pointer which they gave was response effort faces major obstacle. In a sense, the response to this particular one. The African Center for Disease Control say the outbreak response is being hindered by several operational constraints right across several affected regions. Many health facilities lack basic necessities, which includes potable water, protective equipment, decontamination materials, and functional materials that they need to go and do their particular work. Authorities have also reported shortage of ambulance and mounting pressure on health workers, some of whom remain unpaid, poor road infrastructure, and persistent insecurity, and further complicating efforts to reach patients and monitor contact. Another pointer which the CDC gave was community trust remain a challenge, which means people in the community, the Uganda community, and other affected communities have become a challenge. The public health officials have identified low level of community trust as one of the most significant barriers controlling the outbreak. African Center for Disease Control warned that misinformation and reluctance of cooperative with health teams are undermining the surveillance cases, detection, and safe burial practices. The agency has called for stronger community engagement, risk communication campaigns to improve public cooperation and reduce transmission. Another pointer they gave was traveling restriction fuel debate. The outbreak has also triggered international tension on over travel policies. According to reports, the United States has urged several European countries, which include Belgium, to adapt stricter entry restrictions for travelers from the Democratic Republic of Congo and Uganda ahead of the World Cup, which is supposed to start tomorrow, which will be hosted by the United States of America, Canada, and Mexico. Well, it continues to say is that Washington have already barred entry to most travelers who have recently visited the affected countries, citing concern over the potential spread of the virus during the tournament. Instead of traveling bans, Belgian authorities are focusing on health screening measures and preparedness plan, which includes quarantine protocols and designated treatment facilities for suspected cases that will be going for the FIFA World Cup in this coming Thursday. The fourth pointer they gave was a vaccine for current strain. The outbreak involves in the Budumbengo strain of Ebola as less common variant of for which there is currently no approved vaccine or specific treatment. The virus spreads through direct contact with the bodily fluid of infected individuals and can cause severe symptoms which include fever, vomiting, diarrhea, and internal bleeding. The World Health Organization has classified the outbreak as an international public health emergency, while African Center for Disease Control has urged government and partners to intensify support for surveillance and rapid response team and infection prevention measures. The fifth pointer they gave was race to contain the outbreak. Health authorities had warned that the coming weeks will be critical in determining whether the outbreak can be brought under the control or not. But the African Center for Disease Control has identified several immediate priorities, including strengthening contact tracing, improving infectious disease control, and also safe burial, and deploying rapid response team to high-risk areas. With cases continue to rise and logistical challenges mounting up, officials says as a coordinated international response will be essential to prevent further spread across the region. Well, that was the analysis that was properly done by the African Center for Disease Control. Well, that is all we have time for in our news around Africa with me, Edward Nyake Toure.